welcome to the 2025 press conference for the Reproductive Rights Caucus for us to announce our priorities. The Reproductive Rights Caucus was formed in 2022 in response to national attacks on Roe v. Wade and reproductive rights. And now we are more than 40 members strong, bicameral here in the state legislature. So we are just a month in to the Trump administration. And in that month's time, we've seen his administration scrub information on essential health services from a number of government websites. We're talking about the Department of Health and Human Services, any mention of abortion, and a complete erasure, or attempt erasure, of trans people's existence with an executive order that declares the U.S. official policy to recognize only two genders. We've seen his administration impose global gag rules, which are restrictions on the provision of abortion care internationally, as well as any information about abortion. We've seen his administration pardon 23 people who were convicted of violating the Freedom of Access to Clinic Entrance Act. And we've seen him nominate a number of extremist anti-choice individuals to his administration. There's too many to list out, but one example is his Attorney General, Pamela Bondi. She will be responsible for overseeing the National Task Force on Violence Against Healthcare Providers, which combats violence against healthcare providers, and she'll also be responsible for determining the country's position on the Comstock Act. Why she is so dangerous is that during her Senate confirmation hearing, she agreed to use her position as Attorney General to protect crisis pregnancy centers. Crisis pregnancy centers are the very entities that we passed a law, first of its kind in the nation here in Connecticut, because they deceive women who are seeking access to reproductive health care. So as our Republican colleagues across the country and here in Connecticut attempt to gaslight us, claiming we're being hysterical and that we're fear-mongering, we're prepared to fight back and protect Connecticut citizens against attacks to their reproductive health care and their bodily autonomy. Last night here in this building, the House of Representatives secured $800,000 that will go to Planned Parenthood of Southern New England for them to be able to spend on reproductive health care services, including getting mifepristone here into the state of Connecticut. And we encourage our Senate colleagues to do the same today. Today you're going to hear from a number of our colleagues on the Reproductive Rights Caucus who are going to speak to our priorities this legislative session. I'll start with one of our first priorities, which would be to ensure sustainable reproductive health care funding here in the state. As chair of the Human Services Committee, my committee is responsible for overseeing the Medicaid program. And here in the state of Connecticut, our family planning Medicaid rate is so woefully low that our reproductive health care providers are losing money every time they perform that service. Additionally, our abortion Medicaid rate hasn't been increased in 17 years, and so the same thing is happening. And so if we want to ensure that folks can have access to the reproductive health care that they need here in the state of Connecticut, we need to ensure that it's adequately funded.